Hello, Prof. Good day. With regards to the FMA one submission, my ACSM program selected is with the Nigeria Malaria ACSM Strategic Framework, which was drafted in 2019. So my response to the question revolves around how the government of Nigeria has used ACSM as a tool to understand and fight malaria in their country. In order to access the briefer of the presentation, you may click the um, URL or the hyperlink, or you may scan the QR code, both for the access to the ACSM strategic framework. Uh, On ACSM program, we understand with the modules that have been discussed that it stands for advocacy, communication, and social mobilization. It is a strategic framework in public health aimed at behavior change, policy influence, and community engagement. This also helps in integrating communication, development, and political science to address systemic health issues. And it also functions as a coordinated set of actions, not just as a single campaign. In ACSM, the three pillars involves advocacy, communication, and social mobilization as suggested in its title. For advocacy, it targets policy and institutional change, uses lobbying, policy dialogues, and media engagement. In communication, which aims to um, have behavior change using mass media, interpersonal methods, and culturally relevant messages. And in social mobilization, it aims to empower communities by engaging grassroots networks, civil society, youth groups, and traditional leaders. ACSM as a feedback loop is understood through its three components that it works together to connect people, messages, and systems. It also builds trusts and solidarity while ensuring systemic support for sustained health behavior change. And feedback loop also happens, also helpful to address stigma, misinformation, and access barriers and make it more effective when the feedback is available. Let's get to the how Nigeria use ACSM framework in its malaria fight. This is developed by Nigeria's National Malaria Elimination Program in 2019. This is supported by PATH, USAID, and other partners. The objective of these discussion on Nigeria Malaria ACSM framework is to enhance public engagement and promote consistent malaria-related behaviors. It also emphasizes local ownership, political commitment, and tailored communication approaches. Precisely, the target in its communication lens is first, how do they target the communication material to be used? Of course, they conducted the audience segmentation as previously discussed in the module. They selected pregnant women, school-age children, and rural households. They also find what the communication channel, which is the from radio to peer education to social media. They also use real life stories to enhance credibility and relatability. And the branding is really important. They use malaria free Nigeria player part. So it's kind of very powerful and really connected to the people, the use of branding as part of their communication strategy. Now, what's the role of ACSM in this particular framework? Advocacy is they want to local officials and traditional leaders to encourage and support malaria in terms of budgeting and planning. And they use social mobilization aspect in reaching out to the community using the community-based outreach, such as mosquito net distribution, door-to-door visits, and malaria days prevention program. They also used they also focus on hard to reach populations with limited healthcare access. In these ACSM framework, they use monitoring and learning as part of their feedback mechanism. They continually use feedback through the data collection and the local inputs used. They also employed a real-time message adaptation based on community response and epidemiology. And they also ensure that a strategy remains relevant and community sensitive. After reflections and involving ACSM framework in its fight for malaria, lessons learned from these engagement is they realized that ACSM strength lies in its multi-level engagement from policy to grassroots. It's really important that we consider that in championing advocacy, policy is really at the heart, influencing our local policymakers. Nigeria's model shows how adaptation, ownership, and responsiveness make ACSM effective. It's really about involving the people, the community, to get part in its advocacy. And applicable not only to malaria, but to other public health and development challenges. That one of the lessons learned is ACSM is not only applicable to malaria, they have learned that it can also help address other public health, since Nigeria is not only facing malaria as it's a problem to public health. So these are the references I used in crafting such a presentation. I hope that with that brief presentation, you have a glimpse of how do Nigeria use ACSM framework in its fight to malaria. So again, to access the briefer, you can scan the code, and you may also click the um, attached hyperlink, and you can also access the full presentation of the Nigerian malaria ACS substitute framework using the code you may scan. Thank you.